Okay, Ken, we're ready to begin.
Okay. Well, this is the September 24th, 2020 meeting of the Seneca Healthcare District Board of Directors, and I am showing it is 3:02, so I'll call the meeting to order at 3:02. I'd like to also do roll call for the board members. Jerry Nielsen. Jerry Nielsen, are you present?
Present, sorry.
Okay, thank you. Kristen Montgomery.
Present.
Thank you. Richard Rydell, are you present? I thought I heard Rich was present. Wondering if he has his... Rich, are you there?
I'm here.
Okay, thank you. And Dr. Walls. Dr. Walls, are you with us? Saw your name here somewhere. Dr. Walls?
Ken, I'm going to run downstairs to assist Dr. Walls with some audio issues.
Please let me
I'll
know.
be away from the,
Okay.
I'll be away for just a moment.
Okay, thank you. That said, I'll note that the full board will be here momentarily. In the interest of time and everyone value and respect everyone's time, I'm just going to start the Pledge of Allegiance. So I ask you to join me in the Pledge of Allegiance. I will begin. So please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Okay, that brings us to our public comment period. We may have to wait a minute so TK can activate people as the microphones. I'm not sure if she's left them muted or not, but I would remind people as we wait that we can speak to items that are not on the agenda. It is time limited, 3 minutes per person who wishes to speak. So I will start that in just a moment. I apologize for the delay, folks. I'm not sure what the situation is, and I'm hesitant to move forward without some assurance that our meeting is currently being recorded. So I'm going to hold off for a few more minutes.
is still not working. So.
Dr. Walls, I believe we can hear you now.
Can you hear me, Ken?
I can hear you now. Yes, thank you. And we're concerned that you weren't going to be able to activate your microphone. So looks like you're here. I have taken roll and we have said the Pledge of Allegiance. TK, I want to share that the meeting is being recorded.
Yes, sir, it is.
Okay, thank you for that. That said, it is the time for public comment period. Again, as a reminder, public comment on board items which don't appear on the agenda. Public can speak to these, but you are limited to 3 minutes. So TK, can you tell me, can you activate that and help us facilitate this?
Sure.
Okay.
Ken, I've taken a look. I don't have any hands raised, and I don't have anybody requesting to be unmuted to address any public comments.
Okay. Absent any public comment, we'll move into approval of the board minutes. This is from our September 15th special meeting. So can I have a motion, if you've had a chance to review those minutes, to approve or to make any necessary changes?
Which meeting? Which one are we doing now?
So, approval of the minutes from our September 15 special meeting.
Okay.
I need a motion to
Because
approve.
I have minutes also from August 27th.
I know, we'll get to it.
Oh, okay.
Just asking for the first one.
Make a motion, Ken.
Well, I'll make a motion to approve.
I'll second.
Yeah, I
This is
did,
Jerry.
Jerry. And who made the motion?
Dr. Walls.
Dr. Walls, thank you. Okay, so Rich, how would you vote on? Aye, okay. Kristen,
Aye.
Jerry,
Aye.
and Dr. Walls,
Aye.
and I'll vote aye. Now I need a motion to approve the August 27th minutes from our regular meeting.
So moved, Ken. This is Jerry.
Jerry, and
I'll
second,
second. This is Kristen.
Kristen, second. Okay, so Rich, how will you vote?
Aye.
Dr. Walls,
Aye.
and Kristen,
Aye.
and Jerry,
Aye.
and I will vote aye as well. That takes us off to the medical staff report with Dr. Cooper. I noticed that we are being asked to approve some initial medical appointments. I'm sorry. And then there are some miscellaneous items on here. I'm a little unclear. Maybe Dr. Cooper, you can clarify this for us. I understand that we will approve these initial appointments as an action item. Do the miscellaneous items with Dr. Brink and Dr. Matrip, do these require action?
I think we just need approval.
The approval of the initial appointments.
Yes.
Okay, thank you for that. So we have 3 initial appointments as identified on your agenda that we're being asked to approve. So I'd ask for a motion to approve those. Tell us.
So moved by Dr. Walls.
Dr. Walls, was that a motion?
So
Okay.
moved.
Okay, and seconded by
I'll second. This is Kristen.
Kristen. Okay. Rich, how will you vote?
Aye.
Okay. Gary, how will you vote?
Aye.
Kristen
Aye.
and Dr. Walls,
Aye.
and I'll vote aye. So those all carry. I notice on under the miscellaneous ones, there's a correction to be made. Is I'm not sure how we approach that. Dr. Cooper, can you help us out there?
I think at the last meeting, Joanne was talking about how there was a mistake made and there was like a 3-day gap between the renewal or whatever. And then so we needed to do a 3-day a reappointment just to cover that gap. So there was no gap in her privileges.
Okay, and so at this point, there's no action required from the board. I just want to make sure that's correct.
I believe so. I believe we voted on it the last time, so this is probably just informational.
Okay, that's what I thought. Thank you for that. Okay, and then we have some policies and procedures that have come from the Med Staff meeting, September 8th Med Staff meeting that we're asked to vote to approve on. There's 23 of them here. I'm not sure if board members have had an opportunity to review, and if they have any questions, now would be the time to do so.
Ken, this is Jerry. I have one that I think is a typo, if I'm reading it properly. In DSS 004.002 meal preparation, in section 3A XVI, it looks to me like it reads cat instead of eat. I'm sure that was just a typo that was missed by spell check. So I just wanted to mention that one because I at first thought we were talking about cat food. And so then the other one I have was MedStaff 002.002. I had a question for whoever can answer it. 3A IVO, it says affiliation references from 3 or more most recent listed on application. And I was just wanted clarification. Is that the same as the 3 peer references that were listed above? I'm not sure what that means.
And I don't know, Dr. Cooper, can you speak to that?
One was a peer reference, and I think it was the other one didn't say peer reference, did it?
It says affiliation references.
Affiliation. So that would be facilities where they've worked or prior employers, as opposed to the other would be personal, professional references.
Okay, so are we saying that we'll only take providers going forward who have 3 recent affiliations, or I'm just trying to clarify exactly what that's saying.
I don't know, because I mean, if we hired a new resident, they may not have 3 affiliations.
Exactly, that's
So,
why I'm asking.
yeah. So,
Jerry, which one, what number on the there's 1 through 23, which number are you talking about in terms of?
From the agenda number, you mean?
Yeah.
Let's see, that would be 16, yeah.
16. Thank you. Okay. Okay, yeah, credentialing.
Can you hear me? This is Joanne. I'm not sure if you can hear me.
Hi, Joanne.
Yeah, go ahead, Joanne.
So the affiliation, if they have 3, they may not always have 3. So if they have 3, we would want to get all 3 returned to us. If they were new and had nothing, then we would review them in that regard. Does that make sense?
That does make sense, but the way it's written, it says from 3 or more, which to me says that 3 is the minimum, as it's stated.
Yeah. Do you want me to make changes to that verbiage?
Well, I'm asking everyone. I'm not going to decide on that, but I'm asking the board and the med staff what needs to happen there.
Okay.
Let's start with the med staff.
I think they should make.
Is that you,
Yeah,
Dr.?
this is Dr. Walls.
Go ahead.
I think that you should not approve it and then let Joanne make the correction and then bring it back.
Okay.
Because if you make a change now, it still has to go back to the medical staff to approve it.
Okay.
That makes sense.
All right. Other things on these policies that need some discussion?
Not that I have.
Okay, so there was a typo correction, which I think we can just request that that be changed from cats to eat. Is that correct, Jerry?
Yes, that's right.
Okay. So what we'd be looking at is for a motion to approve all items listed on our agenda with the exception of item number 16, policy, the credentialing policy, which should go back to med staff for some discussion. So can I have a motion to that effect?
So Ken, do you want the motion to, are we including the rescinding the policies in this, or are we doing that separately?
Let's do that separately.
Okay. So I'll make a motion to approve policies listed on the agenda as 1 through 23 with the exception of number 16, the credentialing policy.
Thank you. And can I have a second?
I'll second it. Dr. Wall.
Thank you. Rich, how do you vote?
Aye.
Okay. Kristen?
Aye.
Okay. And Dr. Walls?
Aye.
And Jerry?
Aye.
And I'll vote aye as well. So that's taken care of. So there's two procedures that are being requested to rescind occult blood alcohol stool and treatment asphyxias in the clinic, both rescinding these policies, number 1 and number 2, as they appear on our agenda. Any comments or questions about this?
No.
Anyone else? No? Okay.
No.
Can we have a motion to rescind those policies?
So moved.
That was you, Jerry.
Yes.
And a
I'll
second.
second. This is Kristen.
Thank you, Christian. Dr. Walls? How would you vote?
Aye.
Okay.
Aye.
Rich Patel, thank you. Kristen?
Aye.
Jerry?
Aye.
And I'll vote aye as well. Okay. So this takes us to item 8, the financial report from Steve. Steve, please jump in. I'm assuming you're on the line. I haven't heard you yet.
I'm here.
Okay, great.
I'm here. Okay. All right. So we're looking at August 2020, second month of our fiscal year. So for the month, we had a net loss of $382,904 versus a budgeted loss of $561,314. Positive variance of $178,000. There were some pluses and minuses. Big plus was that our revenue far out exceeded our budgeted number by $424,000. Total revenue was $2,236,000. That's still less than August of 2019, but a continuation of the improvement as we, at least for the summer, experience a bit of a post-COVID return to utilization of healthcare at Seneca. Outpatient was really the driving force as our inpatient stays, although right at budget, much lower than last year, mainly due to the we have very limited swing bed, which are elective admissions, and our long-term care is now down to 11 residents, although we are looking for permanent placements to add to the 11. So really, it was all in the outpatient side, specifically surgeries back up and running, and we had some very high utilization of radiology. The adjustments to revenue were right about budget percentage-wise, 56.6 versus 56.9. Expenses, total operating expenses were negative 121,000. Big piece of this was the one-time payment we made to the full and part-time employees, recognize their efforts during COVID, the COVID experience, and then also in lieu of any wage adjustment for 2020. That was the gross amount on that. Salaries was $97,500. Salaries were over budget, $67,000. So net of the one-time payment, salaries had a positive variance, but in turn, the contract labor was over budget, about 42,000. We had 99.3 FTEs for the year versus a budget of 103.66. The contract FTEs were 8.74 versus a budget of 7.6. So in total bodies were a little bit under budget. Although by having more contract labor than regular employees, the hourly wage we pay for contract labor versus an employed individual, employed person is in some cases nearly double. There was a little bit of a negative variance on supplies that related to both supplies and purchase service were COVID related. The supplies were for the PAPR, respiratory devices, and the purchase service was for additional utilization of LabCorp for some of the testing we've been doing. In your materials under the department reports is Dave Mundy's latest update about where we stand with the machine we've purchased. And all systems go just like everyone else, waiting on reagents. So hopefully this month. Everything else was mostly in line. We did bring in just under 74,000 in non-operating, under non-operating income, some of the CARES Act funding. I updated the CARES Act analysis at the back of the financial section. We still have $3.3 million of unrecognized revenue. So I did report in the treasurer's meeting, we may be moving some of the PPP money back as a liability. I think the general consensus right now is that everyone's going to treat that as a straight loan until the forgiveness application is done. Our forgiveness application, the end of the 24-week period, will be the middle of November. So we'll just keep it as a liability there and stop recognizing any future income. There's still a little over 200,000 of unrecognized PPP loan money as far as what's not been brought into income.
Steve, can I just interrupt you for a second? When you say the consensus is to categorize it as a loan at this point, I'm just wondering for everyone's benefit if you can speak to who the consensus includes.
I think it's a general sense from how my peer and our fellow hospitals, their auditors are looking at it, those that have already undergone audit. OSHPD is asking us to move for our quarterly reporting. I've not seen any definitive guidance from like a financial accounting standards board for either the PPP loan or the CARES Act funding. So right now it's kind of somewhat of a dealer's choice, and it makes little to no difference because we've received the funds. There's been no discussion, at least on the CARES Act side, about repayment. They have issued some standards I think this week, very recently, some standards about the accounting that we need to do to account for what we've done with the funds, which we have done. And then on the PPP loan, that's real straightforward. It's as soon as we do the forgiveness application, that will determine how much, if any, we have to pay back. But what we don't know is I haven't seen any definitive guidance on how to classify it on an interim basis. So again, I don't care. You call it a loan, call it revenue. The money's still in the bank, and we know that with the PPP loan that a very, very high percentage of the amount will be forgiven because we kept all of our employees. There were no layoffs, no reduction of workforce. related to COVID, that is, or voluntary. I don't know what the right way to say it. The only reduction in workforce we had was people resigning and people that were subject to some kind of employment action, which we may have to go back and forth with the bank on that. There's just, when we look at our decrease in FTEs, which there has been somewhat, that what we're doing, that this person left, this person was let go, and our efforts to replace those positions.
Okay.
So
that explanation.
yeah. I updated my forecast, and my forecast is still based upon budget. The forecast for the remainder of the calendar year, September through December. So we're going to probably better that because we know the revenue is clearly running higher. September looks to be just under, somewhere around 1.9, between 1.9 million and 2 million, which is above budget, and but again below prior year, September of 2019. When we get beyond December, that's when we'll start seeing some of the supplemental money come in, the rate range payments, and an HQF payment, and that'll essentially bring us whole for the year. You can see in the projections or in the budget that we put out that provided to you last month, that's how we're going to significantly reduce our loss. We may not, bottom line, when you consider the intergovernmental transfer we make, we may have a negative for the year. That's a possibility, but we're still, based upon that projection, sitting on over 200, something around 200 days cash on hand, which we've really never been that high since I've been looking at it. So in short, finances are exceeding expectations, if you will, with unfortunately fairly low expectations, but that's reality. So that's good. That's the good news there.
Okay.
Any questions about the financial report for August?
Steve, this is Jerry. I just had a question kind of overall. Are we seeing folks that weren't utilizing services, when everything was completely shut down, are they coming back now? Are we seeing them kind of come to turn around, or were they still kind of staying out and not getting their just their regular needs met?
Yeah, probably Dr. Walls and if Dr. Cooper's still on, they can speak to what they're seeing, but the numbers are up, but they're not up to where they were before. So I guess from a very high level, we can say, yes, some of them are coming back, but some of them aren't. I don't have a more definitive thing. Again, I don't know what Dr. Walls and Dr. Cooper have specifically seen in their practices.
May I say something? It's Dr. Ware.
Absolutely, Dr. Ware.
We never stopped, Jerry. We never stopped seeing all these people. So it's the same as it has been for the last 3 or 4 months in my practice.
Okay, so the folks that were staying away are not starting to come back yet. Is that what you're saying, Dr. Wells? I'm sorry, Dr. Ware. Yeah, I meant Dr. Ware. I'm sorry about that.
Dr. Walls, can you weigh in, give us some insight, your perspective?
Well, I think my office has had a turnover in personnel, so it's really hard to say. We're putting a lot of people off because I'm transitioning to a new system in my office. So the volume is way down. But I would say there are still people that don't want to come here because of the COVID fear.
Yeah.
I'm just wondering if there's anything we can do to help communicate to our patients that aren't coming in, you know, the steps that we're taking to make sure that they're protected when they do visit. I'm
Yeah,
asking
you know,
whether there's some sort of outreach we could do.
I can talk to Lindsay about that, but I think we've yeah, maybe in our effort to communicate how we're making things safe for them, that maybe that's a little, that can be a touch disconcerting or of concern. But I can talk to Lindsay about that, because I think one of the things is that it's pretty clear. Whatever else is going on in other parts, that the COVID activity in Plumas County has dropped dramatically, and now with the population leaving, you know, that's a good thing for us. The activity in the Chico and Redding area are down a lot. We're seeing what they report daily in their bed count, and their availability for transfer is much more reflective of less intensity of COVID. So I think that from that perspective, things are settling down. Lassen County, same thing, has settled down as well. So I'll get with Lindsay.
Yeah, I'm wondering, maybe it's more of a matter of individual offices, you know, maybe calling a patient that normally would come in to see once a year for a physical and seeing if we can get them scheduled.
Okay. Lindsay may even be on the call, but I will follow up with her.
Okay, well, I would imagine that we're going to see some turnaround when and if a vaccine comes about, but it may be some reticence until that time. That said, can I have a motion to accept the financial report for August?
So moved, Ken. This is Jerry.
Jerry, and can I have a second?
Hi, sweetheart. How are you?
I'm sorry. Can I have a second, please?
I'll second that, Dr. Walls.
I think we may be able to do it online.
Yeah, I think we have someone on the line who's not muted. Please, if you're not on the board, please mute your microphones at this time.
Ken, I just took care of that.
Okay, thank you. All right, so we're just going to move on to our agenda items that are informational only. Oh, I'm sorry, I didn't do the vote on that, did I? Okay, Kristen, how do you vote?
Aye.
Aye. Okay. Rich, how do you vote? Rich, are you there?
I think we might have just lost. Oh,
aye, okay. Dr. Walls?
Aye.
And Jerry?
Aye.
And I'll vote aye. So the financial report has been accepted. Moving on to agenda items for information only. This was carried over from last time. I know we had some discussion about the precision instrument approach at Chester Airport. Can't quite recall where we left that. Rich, I know you had an interest in that. Do you have any information?
I would like to defer this to our next meeting.
Okay. It's just informational, so we can carry it over. Okay. Steve, and that brings us back to you with the HRG report.
Okay, real quickly. So for the month of August, our AR days decreased from 68.9 to now 60.3. It's still outside the our target range of 45 to 55, but obviously finally some progress and some traction, and we're continuing to see some good collection payments and activity on the AR in the month of September. So I think we're on track now. And in the treasurer's meeting, I mentioned to them that I've talked to HRG about the contract. We've got them to go down to a year. They still don't want to have a 90-day out or anything. They're willing to commit to just a one-year contract, get us the new clearinghouse software, and keep the penalties, incentives, and disincentives in there. So I think we're going to be good to go with a contract to bring to you guys in October, and we'll be able to move forward with HRG. So I consider that a good report.
Great work on all of that.
Questions? Yeah, be nice here that I'll be able to get back to doing some of this revenue cycle stuff that I've kind of went away from here for the last few months. So that'll be a good thing, and look forward to continued progress and getting closer to our goals.
Yeah, thank you, Steve. That's great.
Yeah.
Okay, so committee updates, Strategic Planning Committee.
There's no update.
No update. Okay, and the CEO Search Committee. Jerry, I'm assuming this will be discussed in closed session.
I would imagine, because Rich and Kristen have been working on this piece.
Okay, and we will do that. And so, Steve, the acting administrator report, sounds to me like you've mentioned some of these things here, but jump in, please. Steve, did we lose you?
Oh, yeah, here you go. Yeah, there's nothing much more to add. You can just see from the timeline getting compressed each month that there's less and less activity. So that's good news. And I talked about the financials, so that's all I have there.
Okay. Thank you again. So let's let me move on here to the committee reports, the departmental reports. So no report from Quality Care Coordination and Patient Safety. We did get a report from Chelsea on, where is that? The Compliance Department report for September. I don't know if you've had a chance to look at this, and I'm not even sure if Chelsea is in attendance. Are there questions?
I just have a comment that I appreciate the thoroughness of the reports that we've received. It's very helpful to give us a better idea of kind of what's going on in the day-to-day operations. So
Agreed.
I appreciate it.
Yeah, thank
Yeah,
you.
Ken.
Yeah.
So Ken, this is Dr. Walls. I have one question. I guess it would go back to Steve, but we had two compliance officers. One was Linda, the former CEO, and the other was Sadie. Now that they're both gone, who is going to be compliance officer?
Yeah, we're talking, this is for me. Yeah, we're talking to Chelsea Major is going to assume the hands-on operations or the duties of the compliance committee, and we're talking to her about becoming the compliance officer and the privacy officer as well.
Okay.
Okay. Very good. So let me get my agenda back in front of me. Okay, how about from Karen Turner? Has everyone had a chance to look at, Karen has a very thorough report here, appreciate that. Any comments or questions for Karen?
No, I think it might be nice if, can the public know about the machine that was ordered and being tested?
If someone is available to speak to it, as Steve alluded to it a little earlier, Karen, are you with us?
Karen is not. We have surveyors in-house. She's down there with them, so she's unavailable. And are we talking about the lab machine?
Yes, the testing.
Yep. I don't know if Dave Mundy's on the call, but his report was pretty thorough. But like I said, the bottom line is that they, and I don't think it was in his report, but this past week, or within the last week, they did all the training and testing, and they are literally ready to go as soon as they have reagents.
I just don't know that the public knows what we're speaking about. What type of machine it is was my point, and what it will be.
Okay, well, yeah, we do make the board materials available on the website. So, but I guess in short, it's a machine that allows us to do rapid testing for gosh, I don't know, what did he say, 21 different virals, including COVID and influenza. We will hopefully be able to, excuse me, the big thing I think in my mind is that we'll be able, when people come in and they're ill, we'll be able to differentiate between COVID and the flu. And that's the thing that I think scares a lot of people, is that, you know, people are going to come in with symptoms that could be, you know, based upon the way that we approach things, could be deemed to be COVID when it's, you know, the flu. And so I think that's one of the big things. The other thing is that it's going to allow us to be able to report to the county public health about, more quickly, I guess, about what we're seeing in our area. So, and that'll be available. That'll be available to everyone with a physician order.
Yeah,
Thank you, Steve.
Yeah, and that is included in a memo from Dave Monday to Steve in the board packet. There's some concern now about reagents not being currently available. Is that right, Steve? You meant that's what you mentioned.
That's what Dave says. That's the hang up, and it's the hang up for everyone. I know it goes hit and miss. Same thing, Quincy has a machine. I don't know if it's the same one as ours, but they have a rapid testing machine, and they have their ups and downs with having the reagents available as well.
Okay, thank you. Okay, and then with the IT report from TK, any questions for TK? Because I just happen to know she's on the line. Hearing none, we'll move on. Thank you, TK, for submitting the report. We have the HR report as well. And I don't know if folks have had an opportunity to look at that or if there are any questions, so please let me know. All right. And I think we then covered Dave Monday's report. Okay.
Yeah, this is Dr. Cooper. I had a question about the IT.
Okay. TK, I hope you're with us. Go
I'm
ahead.
here.
Yeah, what's the question? Dr. Cooper?
I think he's muted.
Dr. Cooper, are you muted? Not hearing you now.
He is. Please press *6 to unmute. Or press and hold the space bar.
Can you hear me now?
Yes.
I can.
Okay. Okay. Well, you know, we had all these, I think, servers that were supposed to have been installed back in earlier this year, and I think Jacob was supposed to do that, and then Jacob is no longer here, and it seems like there's been no movement on trying to replace Jacob or to get these servers installed. And I think, you know, I don't know if that's part of the problem that we're having with our system, is that we're not updating the hardware that we've already purchased and it's been sitting up there.
Dr. Cooper, you're almost got it there. Actually, those are switches, not servers. And the configuration from the old switches have been performed, and we're in the process of updating that information onto the new switches for installation.
Okay. Not hearing any further response to that. I think I will move to item number 14, items to be added to next month's agenda. Board members?
Well, there is the, I'm sorry, this is Dr. Walls. There's the instrument approach at the Chester Airport that Rich was going to bring back.
Okay.
And then there's the credentialing policy that has to be revised that will come back.
If there is anything after closed session, can we add?
Good question. I believe we can.
I don't see why not.
Okay. Okay, there will be our standing items as well as those 2 items mentioned by Dr. Walls. With that said, let's take a 5-minute stretch before we move into our closed session to allow TK to clear the room. And TK, I trust that you'll just let me know as soon as you've accomplished that.
Yes, sir. I'm going to stop recording now and begin placing guests in the waiting room.
Thank you so much. We'll take about 5 minutes and reconvene. So it's 3:48 now, 5 minutes.